Okay. I'm here with Dr. Francisco Maia, aka the Canine PT. That's PT for physical therapist. Canine PT specializes in helping senior dogs improve their independence with their daily routine so they can live their golden years without the need of pain medication. Francisco is a doctor of physical therapy on the human side, who then brought his knowledge of orthopedics and sports medicine rehab to the world of animals, becoming certified in canine rehab in 2015. He practices in Chicago, where he resides with his wife and two dogs, Ringo and Lieutenant Dan. And you can learn all about the Canine PT at thek9pt.com. And that's the letter K, the letter 9, thek9pt.com. And they're also on Instagram, where they have all kinds of helpful videos on dogs doing all things physical therapy. And that's at thek9pt. Francisco, welcome.
Thanks, Tim. Thanks so much for having me over today.
So why don't you take a second to fill in anything I may have missed there, and we'll get right into your story and all about all things senior dogs.
Yeah, no, I think you pretty much covered it pretty well. I think we're going to talk a little bit, my transitioning from working with humans to canines and getting my own business and the mission that I have of pretty much changing how we can help senior dogs, as they age, continue to living like a full and happy and healthy life, So you got it all covered pretty well with the intro.
Okay, so what was the story that got you from working on humans with orthopedics, sports medicine, rehab, and then taking all that knowledge and coming over to the canine side of things?
Yeah, so I was never a kid or a teenager that thought about doing anything related to like veterinary medicine or anything like that. I knew from a young age that I wanted to do physical therapy. I remember I played soccer at a high level through the different academies in Brazil where I grew up, and every time I would find myself getting hurt, I would always, and I'll be in the treatment room, I always find myself being curious about it. And I'll be asking questions about why they were doing this, why they were doing that, and how did that work. That I've realized when I was about 14, 15, that that's what I wanted to do. So I ended up then moving to the United States to go to college. I attended college over here, went through the whole track to be a doctor of physical therapy in the United States, which for those people who are not familiar, it does take at least 7 years of schooling to get through the process. And then I was out there and I had graduated and I was working in Pittsburgh with athletes, primarily like runners, CrossFitters, just, young adults who are like active and healthy, and like some high school students at the local high school. Up until I found out that we as physical therapists in the United States could also get certified to work with animals. And I always loved dogs. I had like a toy poodle growing up, Johnny, who lived for like 16, 17 years. So even though it never piqued my interest in work with animals, it has always been my passion. And when my wife and I adopted Ringo from the Western Pennsylvania Humane Society back in 2010, it just sparked the interest even more. I think like all of us who had like a childhood dog, of course, we always loved having that dog. But once you're grown up and you have your own dog, it's a little bit of a different dynamic, I feel like, because you're the one that dog looks up to, like you're everything to that dog. And it was the same thing with Ringo. And that really piqued my interest of kind of like, okay, like what can I do to help dogs? And once I find out that I could get my knowledge, my skills as a physical therapist, go through extra training and apply what I knew to help canines, like for me, that was like a no-brainer at all. So this was back in 2014. I went through 200 plus hours of like training through the Canine Rehab Institute in Florida, got certified as a certified canine rehabilitation therapist, and have been working with canines since 2015 and have never looked back ever since. I enjoyed my time with humans, but working with dogs is just so much more fun.
What are some of the primary differences that you had to learn between the therapy for humans and then getting up to speed on providing similar sort of therapy for dogs?
Yeah, so that's a question that I get asked pretty often, especially by my physical therapist colleagues. that get curious about it once they find out that we as PTs can work with animals as well. Because to be quite honest, the foundation of what we do is the same. It's just applying what we know already as physical therapists to a different population. So of course there is learning the anatomy and physiology of the canines, which once again, the anatomy is actually very similar to humans. The muscles have more or less the same names, even because it all comes from Latin. The actions, the origin and insertions that we have to learn as physical therapists, it all carries over into the canine anatomy as well. It's just really one learning, the regular, medical conditions the dog have it that sometimes is similar, but sometimes can be a little bit different than humans. Learning how that applies to their anatomy and physiology, but then coming in with what we know as physical therapists into how do we help those conditions and how do we help those dogs get better, right? And the interesting thing, once again, is that at least here in the United States, there's no degree as an animal therapist or animal physical therapist. Like everyone who works in the field of canine rehabilitation is either a physical therapist like myself, who was trained to work with humans and then got trained and transitioned to work with animals, or there are also veterinarians who went on to do the same certification courses that we do together to learn about rehabilitation as well, because veterinarians also still don't learn about rehabilitation in veterinary school either, because it is still a very new field, right? So it's kind of cool going through the certification, the training together with veterinarians, because we all come from a different perspective, where veterinarians, of course, come from more the medical training sides of things, where physical therapists come from like the functional sides of things. So as physical therapists, we become very, very good over time about like how the body moves, how, like, if you have a knee injury, for example, how does it affect your whole body, right?
Mm-hmm.
Because when I'm rehabbing a patient that, let's say, just had a knee surgery, like, you're not just rehabbing that knee, the whole body moves as one thing. The body doesn't move as separate joints moving together. So when you have an injury in one knee, it has a cascade effect that it affects how the whole body moves, and it can create issues on the other side, on the shoulders, on the spine, or anything like that. So as physical therapists, that's what we really train through physical therapy school, is how to look at a whole body as a whole. So then when you put that together with animals, it just makes sense. It just takes a little bit of time to also learn the handling of the dogs, right? Because that's something, of course, that we don't learn in physical therapy school, how to handle dogs. We learn how to handle humans. But then, I did some extra training with some dog trainers on positive reinforcement and other techniques. So that way I can get my patients to do the things that I want them to do without, of course, forcing them into doing that exercise or putting them in a position that might be uncomfortable for them or whatnot.
Got it. Now we're going to focus this episode a bit on senior dogs and specifically around arthritis.
Mm-hmm.
So, before an owner comes to you with their dog, what might they notice? What are the usual signs that they notice and that their dog has some joint problems or maybe early signs of arthritis?
So the one thing that for those of you who might have been following us on social media or maybe start following after this episode, you see that we're always trying to educate pet parents about arthritis, because the reality is that arthritis is normal. It's a normal aging process. We go through it as humans, our pets go through it. It's just a matter of like how you manage the symptoms of arthritis. And it doesn't happen overnight. Arthritis is something that is degenerative and it slowly happens. And then sometimes there is a traumatic event that aggravates the symptoms. And most often than not, that's when pet parents take their pets to the vet. It's when, let's say, they're playing at the dog park and another dog kind of like jump up on their back or something like that, and then they become kind of lame. They go to the vet, and the vet does X-rays, and they look at the X-rays, and let's say it's a 12-year-old lab, and then they look at the X-rays of a 12-year-old lab, and odds are that dog's going to have some form of arthritis, either on their spine, on their knees, or their hips, which are the most common sites for it. And then they get diagnosed with, okay, a Fido has arthritis, here's some rest, just take it, here's some medication, just take it slow and let Fido rest. And that's what I try to really educate pet parents, is that there's more out there than just rest and medication, that there's so much more we can be doing for our dogs to help them manage their arthritis. And the earliest we start with them by being preventive, the better off we're going to be, instead of just waiting for things to become chronic and then trying to deal with things
Mm-hmm.
afterwards, right? So, so signs that pet parents usually notice if it's not a traumatic event like the one I described at the dog park, it would be just generally them slowing down. So maybe they're not able to go on the walk as much as as long as they used to before. Or if here in Chicago, a lot of people tend to live on like walk-ups on the second or third floor. So people start noticing that the dog's having a hard time going usually up the stairs, and they need some extra help, some extra assistance. So usually that's the tell sign that something is going on, that they're just getting stiffer, they're just getting weaker, they're just getting slower. But like I said, usually it's more of like a gradual
Mm-hmm.
progression kind of thing. And the earliest we start some sort of intervention, the better off we're going to be.
Now, to get technical about it, before we go into it further, what is arthritis?
Yes, good question. So the word arthritis comes from Latin, as most medical terms come from, and arthro means joints, and itis means inflammation. So the word itself means inflammation of the joint, right? And that usually that's what makes it painful. It's the inflammation itself. That's why when you do go to the vet for especially an acute episode, they do prescribe some sort of anti-inflammatory medication, and it helps in the short term. For the first 1 to 2 weeks, that medication kicks in, the inflammation goes down, and the dog feels better. And it helps. But the problem is we're not then developing the long-term plan of building up strength, of loosening up your muscles, loosening up your joints. So that way we're tackling this with a long-term solution instead of just putting like a Band-Aid on it
Mm-hmm.
by giving them anti-inflammatory, right? Now, interestingly enough, it doesn't mean necessarily that there's always inflammation on the joints. Sometimes the joints are they just get thicker and they just get stiffer, and you feel that sometimes when you could be kind of like feeling on your dog's knee or hips that crunchiness kind of thing. That's arthritis. When you're flexing and extending their knee and you feel that crunchiness, that's kind of like the arthritis. And you see that a lot of dogs sometimes are okay with it. They're not uncomfortable, so it doesn't mean necessarily that it's painful. But over time, it can lead to inflammation, it can lead to weakness, and it can lead to stiffness.
So arthritis is inflammation of the joint. Now, I mean, we use the word joint all the time, but what is a joint exactly?
Yeah. So a joint is anything that it helps the body move, right? So that it connects one one body part to another. So, for example, the knee would be the joint that connects our thigh bone to our shin bone. The hip joint connects the thigh bone, the femur, to your pelvis. And like I said, as physical therapists, we learn how all those things work in motion, because they all play a cascade effect on how one joint affects the other. So, for example, if a dog has arthritis on the hip, then it's going to affect the spine, because it's going to change the biomechanics of the hip, and then the way they walk is going to put more stress on the spine. So as those joints are kind of like connected to one another, they do have a cascade effect that play a role. So, and you have like all sorts of joints, like the knees and the hips would be the bigger joint, but even like like our fingers or their toes, every single one of our fingers is a different joint. You have the wrist, you have the ankle. On the spine itself, pretty much we consider each space between each vertebrae is separate joint, right? So all of those joints are just moving in synchrony to make sure that we're moving efficiently. And when one of those points get affected, it can affect all different sorts of parts of the body.
And so within the joints, there's a lot of connective tissue. And by that meaning you have both tendons, ligaments, muscle, fascia.
Mm-hmm.
And what is normally the inflamed component when you have arthritis?
Yeah, so surrounding the joint, yeah, you're gonna have all those things going on. You're gonna have the ligaments, the tendons, the muscles, the fascia, the connective tissue around it, the joint capsule. So the inflammation can also cause swelling, which then if there is swelling, then it can also limit, how those tendons are moving within the joint. And of course, it can limit the range of motion. So a lot of times, if you think about, like a really swollen joint after surgery or something like that, the joint doesn't move as much as it should because that buildup of fluid is limiting the range of motion. But it affects the whole area. And for example, one of the most common injuries we see in dogs, for example, is their ACL tear, right, which is a ligament in their knee that gives stability. So when a dog tears their ACL, even if they have gone through surgery or if they didn't, then we know that joint, that knee, is going to be predisposed to developing arthritis later on because we're changing the biomechanics of the joint, either through surgery or through the injury itself, right? So the inflammation itself is not just concentrated to just one aspect of that joint. It affects the whole joint capsule itself, and depends if the inflammation is a little more spread, and if it is painful, then it starts affecting those muscles and tendons that are connecting to the joint. So for example, let's talk about the knee. When you have a knee that is swollen, well, we have, for example, our quadriceps tendon that attaches to the knee, that is pretty important functional muscle to flex and extend the knee. So when that's inflamed, it affects our ability, or our dog's ability, to really move that knee in space. And a lot of times it can create that tightness on the muscle itself. So it can create trigger points, it can create knots on the muscle that we need to loosen it up through modalities of treatment or through hands-on treatment to get that muscle feeling better. And once again, that's why it's important when we're addressing the itis of inflammation to not just rely on the medication itself, because yes, the medication is going to help with the inflammation, but then you have all these other aspects around the joint that if it has been affected by especially if it's like a chronic issue that has been going on for a while, we need to be addressing those muscle tightness. We need to be addressing those muscle weaknesses. Otherwise, it's just going to create this snowball effect where the dog is just going to get weaker, and then you're going to go back to the vet, and then the vet's just going to prescribe more medication and everything. So that's why we're a big proponent of just getting them moving. I'm a big believer that movement is medicine. Of course, we don't want to overdo things. There is a right and a wrong way of doing it. That's why if your dog is dealing with any sort of chronic issues, I always recommend them working with a professional that can guide you through the process. But movement is good, right? And a lot of times I think because I see this often with our clients, that our first instinct when our dog starts to slow down is that we tend to let them slow down because we feel bad. We don't want to push them, right? It's a natural human instinct that we want to protect them, right? And in terms of protecting them, when we're trying to do that, then we actually are allowing them to get weaker. We're allowing them to get stiffer by not letting them actually move around in ways that they can't move around. So that's why I'm a big proponent of using exercise as medicine, because the more we move, the less stiff they're going to get, and then the stronger they're going to get over time as well.
Yeah, it seems like it can be a downward spiral where you see the dog slowing down. You think, okay, they need to rest more, or if it's a smaller dog, I need to pick them up and carry them up the stairs. But then it can just cause a downward spiral, right, where the muscle ends up getting weaker, and therefore the joints end up getting weaker, and things stop moving the way they were intended to, and a lot of these things come up.
Yeah, and I use the term that I use when I'm educating people is just like a snowball effect, right? Where our dogs slow down, and we feel bad, and we let them slow down, so they get weaker, they get stiffer, so then they slow down even more, and we let them do even less, and then they get even weaker, even stiffer, and it just creates this cycle that it just keeps going around and around and around. And unless we break that cycle, we're just going to let that happen. And it's interesting that you mentioned about the little dogs being picked up too, because that's true as well. Like a lot of times when you have little dogs, you have that option. of just picking it up. If you have like a 120-pound dog, like, yeah, that's not an option. So then you just figure out different ways that we can help them get around. And nowadays, there are devices that can help, harnesses and stuff that can help get them up in the car, up and downstairs and that kind of stuff. But a lot of times the little dogs are the ones that we just pick them up and just carry them around and really don't think about letting them do what they need to be doing by getting around, and it creates some of those issues in the long term.
So let's take a typical case study. What's one of the more common specific issues that you'll have a patient come in for, and how do they get referred to you? Do they come to you directly or from the vet, et cetera?
Yeah, so by far the two most common issues we see, one is just like aging, arthritis kind of issues, so just general weakness. And dogs, when they develop arthritis, more often than not, it's going to be on the back legs, or it's going to be on the spine, and it affects the back legs. Yes, they can develop arthritis on their elbows and wrists, but that's much, much less common. So usually we're going to see them for weakness on the back legs, difficulty getting around, difficulty going up and downstairs, jumping up on furniture, going for walks and that kind of stuff. That would be probably the number one thing we see our patients for. And then the second one, like I alluded to, is for ACL tears, because that is the most common orthopedic injury. And we see patients both after surgery to help them recover from surgery, but also sometimes if it's a partial tear that didn't require surgery, we can help through that conservative management to try to prevent from getting worse and getting them better and avoiding surgery. Mm-hmm. So we see kind of like both scenarios in that case. And for our practice, for our business in particular, the majority of our clients come through direct to consumer marketing. So like I said, we do a lot of stuff on social media, but we also do a lot of other educational stuff to talk directly to the pet parent about how physical therapy can help them. And then once they contact us, if they're local to Chicago, of course, then and they want to work with us, then we contact their veterinarians, their primary care vets, to get the medical records, to get a referral form signed so we can see the pet and, take care of all that kind of stuff. Or, sometimes because we are so active on social media, we get messages from people that are outside of Chicago, and we have created even an online course, so that way at least even those people who are not in the Chicago area, and especially for those who don't have maybe someone close to them that does canine rehabilitation, they can still learn some of the basic stuff they can do on their own to help their pets as well.
Yeah, I could direct listeners that there's two resources that you have. One is caninemassageandwellness.com, which is where the course is. And again, that's K, the letter K and the number 9. And then again, on your homepage at the Canine PT, you have a guide called Senior Dogs Guide, 5 Tips on Caring for Older Dogs. That's a free download, right?
Yeah. And actually, by the time this podcast comes out, we're probably going to have even more free downloads on our website that we're working at as we speak today. That it should roll out by the end of this month in October. So by the time the episode comes out, if you go to our website, thecaninepT.com, you're going to see even some newer options of free educational material for you guys to download. Got it.
Now, so in addition, what's a typical exercise you might have a dog do? Let's say they do have one of those, let's just say a dog that you notice is slowing down and their owner is really proactive about this dog's health. And they say, I'm going to take my dog to Francisco and get him ahead of the curve here so that we don't have that snowball effect. What's something that you might put a dog through who's a normal, healthy dog, but who's starting to show some of those signs so that you can get ahead of the curve?
Yeah, great question. So the first goal with every patient that we see is to get them feeling better and moving better, right? So more often than not, when they come, especially if they're aging and slowing down and having weakness, they're going to have some tightness and stiffness either on their hips or on their spine or both of them. So we do a lot of hands-on treatment to loosen those up. And then I actually teach my clients different active exercises they can do at home on a daily basis, multiple times a day. So that way we can maintain what we have gained through the hands-on treatment. right? Because yeah, I can get my hands on and do different techniques to help loosen up their spine, loosen up their hips. But if we're not doing anything afterwards to maintain what we have gained, then once again, it comes back to that snowball cycle. It's just going to keep coming back. So it's important to develop a regular daily routine with them on not just walks, but different exercises. So the first thing that I do is usually like a spine extension exercise. And there are two different ways of doing this. You can do either with your dog on a seated position, if they have a pretty nice and square sit, or you can do with them on that sphinx position where they're laying down on their chest, looking like a sphinx, right? Mm-hmm. And from there, what you're doing is guiding them with a treat. You just have them reach forward and hold that position with the treat, and keeping an eye on their spine, especially right at the middle of their spine at the thoracolumbar junction, where the thoracic spine meets the lumbar spine. That's the area that has the most movement, but also the area that tends to get pretty tight. Mm-hmm. And I'm keeping my eye on that and seeing if that spine is elongating and stretching. And once it is, we hold that position for like 3 to 5 seconds, and then we relax. And then we do that a few times, right? So for those of that are listening who are maybe practice yoga, it will look kind of like doing like a cat camel or like a cat cow stretch, where you're flexing and extending the spine, right? So we're preventing that stiffness from building it up again, and we're keeping the joints lubricated. So that's usually the number one exercise that I start doing after getting my hands on and loosening them up.
Okay. Now on that ebook download, you also talk about optimal nutrition. Can you share a little bit about that?
Yeah, so I think, of course, and I've listened to some of your previous podcasts, and you've touched based on that already about nutrition with some people who, much more knowledgeable in this topic than I am. But I'm always trying to educate people about, especially if their pet is obese and they need to lose weight, which unfortunately it is something that is becoming more and more prevalent, right? Because when we're talking about managing arthritis in the long run, there's a few key things that we need to do. One is losing weight if they're overweight, because if they have more weight on their joint, that means that joint is taking even more stress than they should be taking, right? And I believe the most recent paper I had looked at is that for every extra pound of body weight that a dog has, is putting an extra 4 pounds on the joint with every step, right? So if you think about that over the course of a day, course of a week, course of a month, it's a lot of extra impact on that joint that it might not already be doing so well because of any chronic issues, right? So losing weight is always a big one. Being proactive with different joint supplements, which there's a lot of them out there on the market nowadays. Having good nutrition, which goes along a little bit with the first two as well, right? And then having a regular exercise routine. And once again, by exercise routine, I don't mean just walking. Yes, walking is great, but we need to work on specific muscles, especially muscles on their back legs and their core muscles, which are the ones that tend to get weaker, and supplement that with the walk, right? Walking is great, but dogs are also very, very, very good at compensating, and they can still sometimes go for a long walk and just really shift their weight to their shoulders and put a whole lot of weight on their front if they don't want to use the back legs. So we need to make sure that we're doing physical activity, but not just walks, but implementing a strengthening based routine to that. So because of all those things playing a role in arthritis, that's why I see nutrition being like a primary role of like what people should be looking for.
Mm-hmm. And what are are there any exercises or movements or activities that an owner can do with their dog, at home, or when they take them out for a walk, or when they take them to a dog park, that does target some of those muscles that aren't used so much in walks?
Yeah. There are three exercises that I see as like my foundational exercises. So after I teach my clients some of that spine extension exercise, and we want to start doing a little bit more active strengthening based stuff, I start with these 3 foundational exercises, and then from there we can really build like the whole exercise routine. But the 3 exercises is the step stretch, lateral walking, and backwards walking. Right. So step stretch, as the name says, is you use a platform. It can be a step, it can be a bench, can be a box. That's also going to depend on like how tall, how small your dog is. And then from there, you have your dog, as long as they're okay with it, step with the front limbs on it. So that way they're getting a nice extension of their hips, they're getting a nice extension of their spine. But also by elevating the front legs, we're shifting the weight to the back legs, and we're starting to work on those muscles a little bit. And if this is an older dog that has really struggled with strength on their back legs, just holding that position for 20 to 30 seconds without even moving, it can be pretty challenging. So that's why usually we start with that, and then we build up from that afterwards. So that's the step stretch. The other one is the lateral walking, which is not a movement that dogs do very often. Dogs usually either move forward or sometimes backwards, but they never move sideways. It's not a natural thing for them to be doing. But I love getting my senior dogs moving sideways. One, because it forces them to move their body in different planes of motion, which it can be good for overall mobility and for teaching them how to like get their body around space. But then also when they're walking sideways, they're working on their gluteal muscles on their hips and strengthening their gluteal muscles. So that's one of the first exercises that I started doing as well. Once again, from there, once they get good at it, there are many different ways that we can progress and make that more challenging. But just doing like 3 to 4 steps to the left, 3 to 4 steps to the right, and then repeat that 2 or 3 times. For a lot of dogs in the beginning, that can already be challenging enough because it's not a motion that they're very used to it. And then the third one is the backwards walking. Now, some dogs do tend to do some backwards walking, especially those like super energetic dogs that, once you get a treat or you fill up the dog bowl, they just get excited to walk backwards. But most dogs don't. And it is probably one of the most important things to work with our senior dogs, because what I see happen often is that senior dogs can get stuck in different spaces in the house, especially like nooks, corners, like that space you have between the dining table and the wall, or the sofa and the wall. And if they get stuck over there and they can't walk backwards, then suddenly, and you're gone for like 6-7 hours, they could have been stuck in that position for a long time, and I've seen that happen. So it's a very good exercise to teach them to do it. So not only we avoid those situations happening, but also it's one of the best exercises to strengthen their hamstring muscles. So it's a very good exercise to activate and start strengthening their hamstring muscles. And then once they get better at it, once again, we can progress to make it more challenging in a variety of different ways. But just starting taking like 3-4 steps backwards and then giving them a treat and getting them used with that motion, it's already going to be a pretty good foundation exercise to get them started with.
Okay, so I think the question people listening would have is, how do I get my dog to walk sideways? Second one.
Yeah. Oh man, and that's really good. Maybe I'll post. Let me do this. I think it's going to be very hard for me to explain in an audio podcast. So maybe what I would do is we have a video that we use in our online course, and that I use with my clients as well, that I recorded with one of my patients showing how to do it. Because you're right, it is one of those movements that it is actually not just hard on the dog, but it's hard on the handler as well. I had a lot of my clients, I showed them how to do it, and then they try to do it and they get like all uncoordinated and stuff.
They tweak their own back?
Yeah, they don't get to that point, but they're kind of like, their hand is like on the opposite side, and they're like, I was like, what are you doing? And they're like all twisted, kind of funny. So yeah, instead of me trying to explain it, how about I'll send you the link to the video, you put that link on the show notes, and then people can go and watch that. Because Perfect. I feel like that's one of those things that like an image or a video is going to be worth 1,000 words.
Right, deal. Yeah, you could do a whole video series that's I don't know what you call it. Getting my dog to walk sideways fail videos, right?
And probably I could, if I was recording every time I worked with a dog and teaching them that routine, yeah, probably I could have had like a whole YouTube channel just about that.
And what about getting your dog to walk backwards?
So that's actually much easier. Like I said, some dogs do have a natural tendency to do so. So it's not a big issue, but the ones that don't, what I do is using sometimes furniture that people might have around the home, like chairs, bar stools, sofa, dining table, walls, and whatnot. I create like a little tunnel. that, and then put like a runner or a yoga mat on there. So that's the other thing too with this exercises, especially the lateral walking, the backwards walking. Don't do it on like tile floor, hardwood floor, because it is going to be harder on them.
More
So
traction.
yeah, more traction. So put a yoga mat or something. But then what I do is once I create a little tunnel, it doesn't have to be long, maybe like 3 or 4 feet long or something like that. All I have to do at that point is just lure them in with the treats. And then they get there, and then they're going to have to figure it out in their heads, like, how do I get out of here? So then once they get out of there, I give them another treat and praise them for it. So that way they understand that, oh, I'm getting the treat for doing this motion backwards, right? So then once they get there, I started luring them in without the treat. And then once they walk away from me, I give them the treat. And then once they get that part, then you can start adding commands. People would do, back as a command, or sometimes just do a hand command where like, move your hands back like that.
Yeah.
So that way you can start adding that positive training component to it. But usually creating some sort of prop, some sort of tunnel with some props is the best way to get them to understand what you want them to do.
So you basically trap them.
Exactly,
First time.
pretty much. You're basically trapping them and trying to see if they figure it out how to do it. And I have, if it's helpful as well, I do have a video about that as well, and I can send you to put on the show notes. Yeah.
Great. Now, what about basic things like, a dog chasing its tail around, or rolling over, those kind of things that dogs do, and often they do them naturally. Especially if you take the dog park. Sonny, my golden retriever, used to just roll on his back, and scratch his back. Dogs do that all the time. To what extent is encouraging those type of movements beneficial for the dog and their maintaining their muscle development?
I think it's all good as long as it's not causing any issues. And if it was painful, if it wasn't comfortable for them, that's when they stop doing those things anyways. Like they're going to self-limit, sometimes doing those things. And those are little things actually sometimes when I start working with a dog, that like a week later, 2 weeks later, a month later, their pet parent will come back to me and say, it's like, oh my God, like my dog hadn't, for example, my dog hadn't itched his ear with his back leg in like 3 months because they couldn't reach it. And then now they can. Like little things like that a lot of times tell me, like, okay, the dog's feeling better. Like jumping up on the bed or jumping up on the sofa. It's another common one that people are like, oh my God, my dog last night jumped up on our bed and he hadn't done that in 6 months, right? So it tells us that the dog is feeling better, right? So that way we are definitely on the right track. The only thing that, a lot of times I tell people to try to avoid it, especially with sometimes breeds that tend to have a predisposition to have spine issues. So especially we're talking about those dogs that might have like a long spine, so we're talking about, beagles, basset hounds, corgis, and so forth. They're just more predisposed to having spine issues. So for those ones, I always try to avoid them jumping down from furniture, because when they jump down, that impact can put a lot of stress on their spine, and we want to try to avoid that. So using like doggy steps, using a doggy ramp or something like that to get up, to get down from the sofa or get down from the bed. Those would be the kind of activities that a lot of times I would try to avoid. But on a normal dog, that those activities that you mentioned, like just rolling around and chasing the tail and stuff, I think when they can do it, it's a good sign, right? Because even if you think about it, for a dog to chase their tail, they need to have very good like side bend flexibility of their spine. And if they don't, if that spine is a little stiff going one side or the other, they're not going to chase their tail, or they're going to chase their tail just going one way instead of going both ways. So sometimes paying attention to those signs, it's actually important. Another thing that it may sound kind of weird, but I'm always asking my clients is like, how do their dog position themselves when they're getting ready to either urinate or defecate, right? A lot of times older dogs have a hard time holding a squat position to defecate. And we need to work on that, because once again, that's a functional movement, and we need to get those legs stronger so they can comfortably hold that position and do their business without any further issues, right? Same thing with urinating as well. A lot of times, but especially male dogs that are markers and they tend to lift their paw to pee, as they age and they get weaker on that leg, the clients know, once I ask them, they're like, oh yeah, my dog always lifts their paw to pee, and now they don't. But then once again, that's one of those things that maybe a month later they tell me, it's like, oh yeah, he lifted his leg to pee, and his balance was super good. And it's like, good. He wasn't doing before because he felt uncomfortable, because he felt weak, because he felt imbalanced. So now we know that the dog is feeling better.
And do you have an opinion one way or the other in terms of dogs going up and down stairs, assuming that there's no impact of them, jumping, but just that motion of going either up or down stairs?
So always better to teach them to actually walk instead of like running and stumbling, the stairs. So they're actually going like one step at a time. That's always the ideal scenario. Sometimes when I do have like older patients and they live, in a house that has multiple levels, I ask clients to put pet gate, so that way, at least during the day, we're keeping the pet at just one level. And then they just have to, let's say, go upstairs to the bedroom just in the evening to go to sleep, and then in the morning once they wake up. But then at least they're not following their pet parent like up and down all day. Especially if you have a pet that tends to follow you around the home as you doing your laundry and getting this done, getting that done, like blocking those steps, because then at least we're preventing them from getting too fatigued. And once again, exercise is good, but we also need to be aware that if they're just going up and down, up and down, up and down, up and down, that can also play a detrimental effect, because we need to have the right dosage of exercising as well.
And we know that weight training is good for humans. What about weight training or weight bearing exercises for dogs?
That's a great question, because that's one of the biggest things that I try to educate on social media, try to educate in person, is that walking is great, but like I said, it's just not enough. We need to do strength training for our dogs, and just like humans, right? So we don't have a whole lot of research in pets as well, in the area of like rehabilitation and stuff, because it is a newer field. More research is starting to come out, but we do have lots of research over the last decades in the area of human rehabilitation and sports medicine. And we know that to get stronger, we know that to build muscle, we need to add resistance, we need to add load to our muscles, to our joints. And it's the same thing with the pets, right? And not to go in a whole tangent, but that's one of the reasons why also I'm a what's the word I'm looking for? I'm a fierce advocate for canine rehabilitation facilities not over relying on the underwater treadmill, right? Unfortunately, one of the things that's getting very, very popular for an array of reasons with canine rehabilitation is the underwater treadmill. And yes, it can be helpful, but it can also be very, very overutilized. And I feel that at this point, I've been working in this field for the last 5 years. I've seen that now it's just completely overutilized. And one of the examples that I use is, let's talk about rehabbing that patient after a CCL surgery, right? Which it is the most common orthopedic surgery. Now we need that muscle to get stronger. We need to add load. We need to add resistance to that muscle, for the muscle to get stronger. But the buoyancy of the water, it's actually taking away the weight from the leg. So it's actually counteracting the purpose of building up muscle, right? That's why I'm a big proponent of more land-based exercises. And yes, using the underwater treadmill for dogs who truly need that buoyancy of the water to be able to like exercise and getting some like cardiovascular endurance component out of it. But the underwater treadmill is not meant to be building strength, to be building muscle mass. For that, we need to actually challenge the muscles. And we can do that, like I said, we start with those 3 foundational exercises, but then from there, there's so many different ways you can progress by using different pieces of equipment, that people might have seen different videos around, by adding instability. Like, you can get so creative with what you do to build up strength. And even with land-based treadmill, you can use a land-based treadmill and create a pretty good exercise routine. Using weights, even sometimes you put it, using a harness that it's used to like pull weights, and you can have a dog pulling weights, just like we can push a sled or something like that in the gym to get our legs stronger. We can do that. We can have the dog pull the weight behind them in an underwater treadmill. And that's going to be much, much better than using an underwater treadmill, right? So that's a big thing. And that's why also I'm a big proponent of empowering my clients, the pet parents, on things that they can do at home. Because we also know that we cannot expect to go to the gym once a week and get stronger, right? I wish that was the truth. I wish that would make my life a whole lot easier if I could just go to the gym once a week, but that's not the case, right? And we can expect the same thing from our dogs. So that's why I'm a big proponent of teaching people what are things that they can do at home, usually for 5 to 10 minutes a day, but really that consistency of doing 5 to 10 minutes a day over a long period of time is going to be much, much better than you just doing one big session once a week.
Right. Got it. Okay. Well, I think we've covered some awesome tips that listeners can take home with them. And it sounds like most of your content and engagement that you see is on Instagram. Do I have that right?
Yeah, we do have a Facebook page as well. Most of the content is cross-shared, for those people who are familiar with maybe run their own pages. It gets cross-shared from Instagram and Facebook. We do some exclusive content to Facebook maybe once a month or so, not very usual. So usually Instagram is the best place to be following us, but you're more than welcome to follow on both of them. But on social media itself, those are the two major platforms that we use, besides doing some, in-person stuff here for the Chicago area as well.
Okay, great. Well, I'll put all the links there in the show notes. But for those listening, on Instagram, it's at the canine PT. That's the letter K, the letter, and the number 9 PT. And then website is the same.com. And you also have your online course, which is at caninemassageandwellness.com. So, Francisco, anything else you'd like to share with our listeners here?
No, I hope, one thing that I hope is maybe this opens people's minds of how to care for their senior dogs. Like we mentioned at the beginning of the podcast, that is one of the things that I'm very passionate about. And the reason I'm very passionate about is because I knew as a physical therapist, and I knew by seeing the results of working with my patients, my dogs, that we can truly, truly help aging dogs live a much better life as they go through the aging process. But unfortunately, that's not the advice that people are getting out there all the time. They're not getting that advice of oh yeah, go start this, go look for a canine rehab practitioner around your area or something like that. So hopefully that has opened up people's mind that canine rehabilitation is a thing, and it's not just recovering from surgery, but it's also by helping our aging dogs live a much healthier, much happier life through that journey.
Yeah, I think that's a great message. I mean, there's more than one pillar to health, right? I mean, I think people focus a lot on food, which is certainly important. I think, when people think exercise, they think just walking, but talking to you, there's, a whole other element and more things that people can build in to their dog's daily regimen to really keep them healthy. And, of course, I'm a proponent of supplements also, but supplements are just supplements, right? And so to me, it's always food and exercise comes first. So great chatting with you. I think people really will enjoy this episode and look forward to getting it out there and sharing it with our audience.
Yeah, thanks so much, Tim, once again for having me. Like I said, I've been listening to some of your past episodes, and I've been truly enjoying it, and thanks for having me as a guest today.
Okay, well, thank you for that. Appreciate it. Dr. Francisco Maia with the Canine PT.